Hi guys, Sarah here from Highland Haven Australian Shepherds and Highland Haven Dog Training, and welcome to Season 2, Episode 6 of Dog for Thought. Joining me is my co-host, daughter, and dog trainer extraordinaire, Sophie.
Hi everyone.
Hey Soph, what's going on?
Nothing much.
You want to give us an update in Dogland?
Talk about Meadow. Meadow was not feeling great last couple days, and she's such a happy-go-lucky dog that when she's really not feeling good, you can definitely tell that she does not feel good.
Yeah.
So we brought her to the vet.
Yeah, so she was throwing up at night.
Yeah.
Which I feel like if you sleep in a room with 7 dogs, there's not a lot of nights that go by that you don't have at least one barf.
Yeah, true.
It's usually early in the morning. It's usually just foamy bile. So I didn't really think much of it when she threw up.
It's hard to tell who's throwing up too.
Yeah, because I don't even want to move, because as soon as I move, then they think I'm getting up.
Yep.
So I just sort of figure out who it was. I guess who it was. So she threw up, and then a couple of times, and I was like, all right, that's a little weird. And then Vivi decided to barf all over the bed at 2 a.m. So that was fun. Mm-hmm. So then I had to get up and change the sheets. And I even had to take the mattress cover off. And then it was just the foam bed topper. Mm-hmm. And while I'm putting that in the wash, Vivi throws up on the foam topper as well. So that was fun.
Super pleasant morning.
But ironically, it wasn't Vivi that was sick. It was Meadow. So I didn't really think too much of it because, it's not unusual for dogs to occasionally vomit, right? Mm-hmm. And it was just like foamy stuff. So I don't normally worry about that. And she seemed okay. Some of the foam was a little tinged with blood. I certainly was like, okay, that I got to keep an eye on. But she went downstairs, ate breakfast, and seemed fine for the rest of the day. So I was like, okay, I guess she's okay. And then the same thing happened the next night. And I'm like, all right, that's maybe not right. Not bloody, but just more puke. And I'm like, okay, that's not right. So the next day, she didn't eat breakfast. And I said, okay. She's one of those dogs who never doesn't eat. I think the only other time she didn't eat was after she had puppies, remember?
Yeah.
And she got so sick.
Yep.
That she didn't eat then either. But other than that, I don't think she's ever skipped a meal in her life.
No, she inhales it. She's the fastest.
And she's 8.
Yeah.
So she's 8 and she eats. So that was when I called the vet, and we ended up getting her in that day, and she has some gastroenteritis, whatever. And they gave her some stuff, and I knew she'd bounce back, and she's fine. Mm-hmm. But, I try, you don't want to rush to the vet, and this is something we can talk with our guests today about. You don't want to rush to the vet with every little thing, so you try to, balance the dog's behavior, the symptoms, and make a judgment of when they need to go into the vet and when they don't. And I always feel like I'm wrong, no matter what I do. If I rush them to the vet, I feel like I'm wrong. If I wait 2 days, I feel like I'm wrong. So, I know everybody can relate to that, You just worry that you don't make the right decision because they can't tell you what's wrong.
I feel like we balance each other out a lot because I'm very much they're fine. They're fine. And you're very much we need to take them to the vet right now. Right now, they're going to die. And I'm just I think they're fine.
Yeah, no, I don't do well with sick dogs. Mm-hmm. Some people really do great with them, dogs that have 3 legs and stuff. That's their bag. They're really good with that. I would be anxious all the time. Yeah. About that because they can't tell you when they don't feel well. So you're trying to go off of their behavior, and depending on the dog, they don't always express their pain, right? They don't always express it in a typical way.
Or the dog breed, Finn was a dachshund and
super high pain tolerance,
yeah.
So didn't really, and Meadow was a big baby,
yeah.
So
yeah.
You also have to know your dog.
Yep.
But anyway, that can be a topic we can talk about with our guest, so we probably should introduce him. Should we get started?
Yeah, let's do it.
All right, so today we have a very special guest, my vet, Dr. Paul Klainbard. He grew up in Ossining, New York. He's a graduate of the University of Vermont, where he studied animal science and nutrition, and vet schools, Ross University and Cornell. After working at various vets' offices early in his career, Dr. K, as he's affectionately known, opened his own clinic, Family Veterinary Care of Ossining, in 2014. Dr. K has been married for 21 years to Suzanne, has 3 children, 3 dogs, a boa constrictor, and a cat. Dr. K, welcome to Dog for Thought.
Well, thank you very much. Happy to be here.
So, since we're on the topic of Meadow, I try to balance when they appear ill, I try to balance how they're acting, whether they're eating, whether they're having diarrhea, vomiting, with how they're, moving around. Are they acting like they're in pain? And I try to then decide whether they need extra attention. I also do time, right? Because sometimes they can seem very sick for a short period of time, and then 2 hours later they seem fine. How would you recommend that somebody make the decision to bring the dog to the vet when they think they might be ill?
Yeah, so first thing I think about, are they very young or very old? I mean, if we have a 5-year-old or 8-year-old dog, I don't worry as much as if I have a 10-week-old dog or a 15-year-old dog. If they vomit once and go back to eating, or, which is gross, if they eat their own vomit, these things I'm happy with. They're obviously feeling okay. And, they go right back to their meal. They go right back to playing. If they start skipping meals, obviously bothers me. If we see blood in the vomit, there is significant irritation, and, something in there is bleeding, and I'm more likely to head to the hospital. Or not necessarily an emergency room, but, go see your vet the next day. Repeated vomiting, inability to hold down water is an emergency. But if, they go back to eating, they'll take treats, and they vomit once or twice, I'd move to easy at-home care, which is generally boiled chicken and rice if we don't have an allergy. A bland diet, give them 6-8 hours of fasting. Don't give them large amounts of food or water at a time. A lot of people will say, oh, they were feeling better, I gave them a whole bowl of water. They drank the whole bowl of water. They're very excited about that, and then the dog just pukes a gallon of water all over the place. I feel like vomiting is one of those things. It's a violent act. The more they vomit, the more inflammation. The more inflammation, the more they vomit. And sometimes you do need intervention to kind of stop that process.
So can we talk about this occasional vomiting at night? What is that about?
So a lot of dogs seem to get some reflux overnight, especially the early morning vomiters. They eat their dinner at 6 o'clock and they've now gone 13 hours without eating. They seem to get some reflux and just puke up yellow foam. Sometimes we can fix that, or at least help it, by splitting the meal, feeding it a little later. Some dogs need some, like an antacid, Pepsid AC, omeprazole. These types of drugs can help them, especially little dogs for some reason. I see that more frequently. But yeah, a lot of these dogs, I find you feed them a little bit early, and then you wake up in the morning to a pile of beaten eggs kind of looking emesis, and it's gross. I always step in it.
And that's what I did for Meadow, right? Yeah. The next night I fed her, I gave her a little bit of a snack right before we went to bed, because I thought maybe she was just a little irritated, and she went almost all night. But then, of course, she started throwing up again. With Meadow, I think she actually might have some reflux because she's clearing her throat a lot. Could that be which is sort of a new thing?
Yeah, it can absolutely be irritating. You can actually get into a situation where they regurgitate enough that it goes down their trachea a bit, and you'll get a dry cough for a while. And that can really take a couple of weeks to improve, because you really don't need acid in your airways. So in people with a similar issue, they sleep with their head raised and take medications, obviously. With dogs, I do feel like we said earlier, feed them a little bit later, feed them smaller meals more frequently, and we would discuss an antacid. I wasn't here last week, so I didn't discuss that with you.
Well, I have developed acid reflux in the last year for the first time ever.
Congrats.
And so, it's lovely. It just occurred to me today when Meadow was clearing her throat more often, and I was like, that's been going on for 6 months now. I'm wondering if this is all related, because that's sort of how I feel today. So anyway, that's interesting. I've always, if I have a nighttime puker, I always throw them a couple of cookies before we go to bed, and that seems to solve things, which is wonderful. I mean, I didn't know that for whatever, and then Google came around, 20 years ago, and suddenly you can Google these things. Why is a dog throwing up overnight, and how can you prevent it?
Well, that happened all the time with Dogtopia, and we would have all the people in the room, they'd be like, so-and-so threw up, blah, blah, and I'm like, let me see it. Can you send me a picture real fast? So I have a lot of pictures of throw up on my phone.
Right.
From back in the day being they're just feed them breakfast, they'll be fine.
Right.
Feed them later at night. And that was always my solution at Dogtopia, so yeah.
Yeah, it generally works.
Yep.
So let's talk about veterinary science in general. There's a lot in the news about mental health and vets. I would say particularly since COVID, everybody's more brittle. more sensitive to things. What is your experience working in the veterinary world? Has it changed a lot since you started? Is it more stressful now?
Well, certainly in my practice it is, because we're just a little bit too busy at the moment. We're working on buying we've already purchased a new building, but it just takes forever to get into it. And, once I can hire more vets, I'll be a little less stressed. But in general, in the profession, absolutely. I mean, it felt like half the world got a dog during COVID, and a lot of those dog owners were first-time dog owners. So one vomit, it's an emergency and they have to come in, which is difficult for us because it's very difficult to tell someone who is absolutely panicking, chill out, feed a bland diet, give them a little time, they'll probably get better, when they want to come in right away. And I'm like, I don't have an appointment for you.
Right.
We're going to have to rush you in between the two other appointments. It gets difficult. But yeah, mental health is a major issue in the profession. There is an organization, Not One More Vet, which deals with suicide in the profession.
Is this a newer thing, or is it just being reported now?
It's from long before COVID. Maybe it's being reported more now. But I mean, I think it starts with, major debt coming out of school. Salaries are not commensurate with like a MD coming out of school. And we're a bit on an island treatment-wise because people are paying out of pocket. If I'm seeing, let's say, a surgery I'm not particularly comfortable doing and I want to spend to a specialist, but specialist fees are way higher and the people can't do it, I'm like, well, I'll give it a shot. But then, maybe I'm doing something that I'm not comfortable with and I'm worried about, that animal's well-being. Where in human medicine, that's generally not the case. You go to your pediatrician, they say, this isn't good, go see a pulmonologist or something. We're a bit on an island saying we're doing that. We're researching, sending out for radiology report, or at least the radiographs, which is actually helpful now that I can digitally send off x-rays. It used to be, we'd have to mail an x-ray to a specialist, wait 5 days for it to come back if we had a question. So that's days. Actually, that's something that's actually happened.
You feel too young to having ever had to do that, but whatever.
We used to have monthly meetings where we would, actually right near here, we would all meet at a larger animal hospital and a radiologist would come up. We'd bring our problem radiographs in like a manila envelope and he would go through.
So now you're saying you share it online to a forum?
No, yes, we can. We do have a forum. There's a paid forum that's moderated by specialists, which is very helpful that we use, and everyone that I know subscribes to it.
Because I know you've done that for my dogs. When I bring in an odd case,
I certainly have
go on your
limited experience in Therio and repro health, so a lot of times I do have to look it up. And I can also just
inflamed foreskins. That's not a common thing.
I don't specialize in inflamed foreskins.
Poor Deacon's like, why is everybody looking at my junk?
Like 3 days in a row as well.
And it happened it was a yearly thing, remember? It was like every spring.
It was like every time we would finish breeding him, it wasn't
when we finished breeding him. It was when we needed to breed him, he would develop a foreskin infection and we wouldn't be able to breed him. And it was a spring thing. So, I don't know, but it hasn't happened since he's been neutered. So I have a feeling it has some combination of
testosterone and stuff. Yeah.
Maybe he was just anxious.
He's excited because he was
wait
so long.
Jeez. I'm like, really? It's been 6 months. And the one time I need you, dude, you can't perform.
Yep. Or it would be like another female that would be coming to breed with him, and he would get inflamed, and you're like, oh.
Anyway, so you shared that one on the forum. I remember that.
Yep. But I can send radiographs to a radiologist.
Gotcha.
Get it read stat in like 30 minutes, or the regular readout is 24 hours. But back to the cost, it's an extra 150 or something like that for a radiologist to read. I don't remember exactly, and double that for a stat readout. If we're trying to figure out, does this dog have to go to surgery right now? Is there something actually stuck in their stomach? Right. That time is of the essence. And then the bill just climbs and climbs, and then you feel terrible because we're trying to fix the animal and not ruin the finances
not
of the client.
Not bankrupt the person, right? And then there's this. Oh well, my vet just took advantage of me, and they ran. I'm like, well. I've always had a great relationship with my vet. Dr. K is my vet, along with Dr. Arucci, who also works at the vet. And before you, I had an old vet named Dr. Bumstead. I went to him for many years, and we were very friendly, and it was always really, I always have wonderful vets. But I also go in with a very pragmatic approach to taking care of my dogs. I'm not going to, for instance, extend a life on a dog who has clearly got cancer, like our dachshund Finn. I'm very clear about what I will spend, what I think is ethical to do to a dog. And but I'm, as my sister loves to say, I'm very emotionally pragmatic. I love my dogs as much as the next guy, but I also feel really strongly about their quality of life. And I think it's such an emotional thing, and people come in and they don't know what is the right thing to do. I'm sure you see that all the time. And they feel conflicted, and they love this dog, and they do, I think, sometimes make decisions that are questionable about the welfare of the dog, not out of being ignorant, just being emotional.
I think that's with getting a dog too, right? You get a dog, emotionally get a dog, even though maybe it's not a great time for this dog.
Like maybe a Tibetan Mastiff wasn't a great idea for you and your young family.
Yeah.
But he was a cute puppy.
Yeah.
Yeah. You hit the nail on the head with the breed.
Gosh, we feel pretty strongly that there's some breeds that you really should have a license to own. Malinois being one of them.
Yeah.
Oh, Malleys are tough. I somehow have a couple of really nice ones right now at the veterinary hospital, which.
But my guess is you have nice ones because the owners are probably pretty responsible owners, understand dog behavior, and can handle that, right? So that person would pass my licensing test.
They might, and it's tough to say. Are they lucky and this one is actually handleable? Because, those dogs are so anxious and driven, and I don't know, I've seen some amazing trainers who just, the dog's in a basket muzzle every time it comes in and starts shrieking before I even touch it.
Right.
They're tough. I also have some Akitas right now that I absolutely trust, and that's not something that's super common with the breed.
Well, at least with a Mal, you know what you get when they come in. You know whether they're going to be a handful or not. And Akita's going to come in with that blank stare, and you don't know if that means he's about to kill you or going to lick your face.
Yeah.
It's the same expression no matter what they're about to do.
Yeah.
So we see that a lot when we deal with dogs, right? They don't always express, depending on the breed, they don't always express in a way that we understand or expect, and then suddenly, bam, we get bitten. So, to be a vet, you have to know so much in order to stay safe and be a really effective vet. So I feel like the specialties have exploded in the last, 10 years, 15 years, maybe more.
Yeah. There are a lot of people who finish their school, then feel like they're not ready, they're not prepared to go into general practice or whatever they're planning on doing. So then they do an internship year, which is, nice. They get to shadow the specialists. Really, they spend probably a lot of their time doing the emergency room. And then they go into the specialties, which are important. But we certainly need more general practitioners. I'm not saying that not having multiple surgeons or cardiologists around is helpful, but we don't have enough GPs around to help all these animals, especially with the influx of pets around here in the last 3 years, 4 years.
Interesting. But to be a really good GP, you have to, I would imagine, have the more experience you have, the better you're going to be, right? Because you just have to see the cases. You have to experience, such a variety of, different dogs or animals, because you don't just do dogs, you do cats as well. Do you do other animals besides dogs and cats?
A little bit of rabbit, ferret. I've seen a couple hedgehogs, some birds. I actually just sewed up a chicken, which worked, surprisingly. Stapled it, skin staples. A dog got it, shook it up a little bit, had a little laceration on its back, but healed beautifully.
We think of Dr. Paul, or I think of Dr. Paul when I think of, a 50-year career in just so many different things. It's just an incredible amount of experience he has, right? And he does large and small.
Yep.
But it's the Murphy's Law now. Murphy's Law? In order to get the experience, you have to have the experience. It's like, it's very frustrating in that way. So I can see how people coming out of vet school who are likely very driven people themselves, because it's no easy thing to get through vet school, would really prefer to specialize, because it sort of cuts down the knowledge that you need to know.
It does cut down a lot. I mean, I treat a couple of specialist dogs for general care because they really don't do it. And you forget these things quick. I mean, I used to have a bunch of goat patients. I haven't for the last 8 years. And I barely remember goat medicine. I did a lot of cows in school. I never did horses. I'm really allergic to horses. That's not true. I did horses in school, but not since.
Interesting. Goats.
Yeah.
All right. So when we get our goats, we can give you more practice.
Are you going to?
No, but our dream was to get some donkeys.
Donkeys and goats.
Mini donkeys is my dream, but
I did have a donkey. He was great.
Oh God,
the donkey was great.
Donkeys.
And goats are great. They're like funny little dogs. They jump all over the place. They're fun. Sheep, not so much. They're kind of dopey.
And this was up in Cornell, I assume.
When I was in
Vermont,
St. Kitts, in Vermont, I did a bunch of cow stuff because we had the cream herd there. It was a student-run like dairy, and they had the Morgan horses up there.
Oh, cool.
At Ross in St. Kitts, we had a dog, a sheep, and a donkey. Who they were all great. The sheep was a little tough. I always had to chase him to catch him to examine him, but the donkey would come running when I called his name, baying, and like come flying down. He was just psyched to see us every day.
Donkeys, they're so freaking cute. I can't stand it. And mules. I'm obsessed with mules too.
Yeah, I don't think I've ever touched a mule.
Well, I've never actually ridden one, but I'm obsessed with them via TikTok.
I did consider at one point opening an emu farm when I was not sure. I was going to vet school. I figured you can do everything with them. It would be an interesting thing.
Gosh, they're miserable. They're so mean, aren't they?
Yeah. Oh, I'm glad I didn't. They're scary.
They're like llamas.
Alpaca and llamas, I'm not
they're tough.
very good at dealing with them.
I would have a hard time not losing my patience with an alpaca when it tried to kick and spit at me.
Yeah, it's a spitting. It's rough.
And emus are scary. They have like those where you're like in a car and you like feed them through the windows.
Yeah,
and
like,
emus come and I'm like, I would be rolling my window up. There's no way I'm feeding that thing. Throw it out the window.
Exactly. You get stuck on the windowsill and just drive.
It's like trying to get its head in the window and stay. You're like, oh, I can't squish its head.
And they can fit that little thing in anywhere.
And there's that one woman on TikTok who has an emu who's always trying to attack her.
Yep. She like sets up the video and like knocks over the video.
Yeah, and she's always got her arm out like, no, don't touch me.
Name's it's like a human name like Fred or like Steve or something. Like
yeah.
That.
Fred the emu. I'm gonna have to look that up.
I feel like we're going a little off topic here, but this is exactly how these podcasts go. So back to mental health. So it's interesting that you said because of COVID, a lot of new dog owners are new dog owners. That didn't occur to me. Like people who've never had a dog before, specifically got one in COVID. I wonder why that is. Just because they were home?
Yeah, I think people who didn't have time, who were working in the office, all of a sudden said, I could get a dog. And they cleared out the kennels. The SPCA, they had no dogs left. The rescues were empty for a while. I did hear in other areas of the country, not so much around here, once the world opened back up, a lot of dogs ended up back in. But I don't know that I heard from them. I work pretty closely with some rescues. Maybe it's selection bias, and the ones that I deal with didn't have that, but didn't really hear much of it.
Yeah, well, where we are in the world, where we are in the country, where we are in the world, we're really quite privileged.
Oh, yeah.
It's very different even just from the south of this country. And we have people who listen to us from other countries, and we always try to keep that in mind. Like when we talk about stuff that's really regional to the state, to the country, to the world, it's not the same in other places. So our shelters tend to, the non-pitties and pitty mixes tend to not stay at our shelters very long because people are, it's just different around here. And they're, of course, always shipping up the hounds from the south.
The hounds.
And I wish they would leave down in the south.
Yeah, we've got a fair bit of hounds in training.
Yeah, hounds are tough dogs to have. And that is something that we've noticed, that the dogs that are sort of coming in from other parts of the country are these hounds, which are really difficult to live with because they come from very country settings where they've been bred for generations.
Working lines.
Not even working lines or just, living outside. It's been generations. Sure. And then they come up to I always say whenever we get, who are we talking about? Was it Nikki?
Yeah.
Whenever we get a dog that's been adopted through rescue and it's two dads or two moms, we always laugh like Nikki's writing back home going, I'm living in New York with the gays and I am living my best life.
Yep.
I mean, who would have thought this dog that was a stray in Tennessee would end up, living in New York City with two dads.
Yep.
And they're always the best owners.
Well, the Dozer too.
Yep, Dozer too.
Yeah.
Yep, the two dads. We have a lot of two dads, two moms clients, and they're always the most diligent dog owners, wouldn't you say?
Yep. So I have a question. For first-time dog owners, what do you recommend? What are things that you look out for? What are things that they should be looking for? Like all that stuff.
Yeah, they seldom ask me before they get the dog.
Well, to be fair, even if they did ask you, they totally ignore you. So
would.
Go ahead.
And they would still come in with a Frenchie.
That's right.
So I do tell people to know themselves because I think in general, you're probably best off taking some money, putting it away monthly in a savings account for your average person, for a dog, for a large dog, an ACL tear, which is running between like $4,000 and $7,000 these days. But new dog owners or dog owners with like brachycephalics with the flat face breeds, I tell them don't even come into me without insurance. Like as soon as I see this dog and find 8 pre-existing conditions,
right, they're
not being covered. And if you want if you need that soft palate trimmed or the nose resected because they just can't breathe in like Frenchies and Bulldogs, you don't really want to be paying out of pocket. In terms of the breed, or just the dog himself, I want the dog that's coming up to them at the shelter or at the breeder's place. Not necessarily the one that's jumping all over them, but if you think you're going to fix the dog that's cowering in the corner and like absolutely terrified of someone, that dog's probably just going to be scared forever, I find. The dogs that come in.
And then they
terrified.
will be calling us.
Yeah, exactly.
Yeah.
Saying, I don't get it.
I don't get it. We try to bring him to the bus stop and he doesn't like all the kids. And we're like, this is not the dog for you.
Exactly. It's rough. I want a dog who's coming up. For example, my daughter was playing with her band at a Harvest Festival this year, and my other two kids went. There was a rescue, and our current dog, Carini, a little pity mix thing, who they call the lab boxer mix, but whatever, that's pretty common. She was sitting in the little run and literally like sitting at them, like aggressively sitting, like staring them in the eyes. And then when they came near, she was hugging them and licking them. And we're like, well, this dog's obviously extremely affectionate, loves people, and is self-confident. And she's been the same dog forever. And we obviously kept her. But the other dog that wouldn't let us pick her up and, wanted nothing to do with us. I don't think that was going to be the right dog for our family. I have 3 kids. They have their friends
as
over.
much as it tugs at your heartstrings, it's again, emotionally pragmatic when you make these decisions.
It's true. Yeah, I feel bad. Maybe they won't have the life of being super spoiled with us, but I don't have to worry about my dog running away, peeing on the floor, and being upset every day of their life because of my family.
And plus you have children, even though they're not little kids anymore, they're still kids.
Yeah. Their friends might not know how to address a dog, might walk right up and pet a dog who's not ready to be touched. I would like to know that my dogs aren't going to turn and bite their hand off.
For sure. Especially since you're the local vet.
Yeah,
that
it's
would
really
be bad.
It is really bad. And my first dog that I got on my own was a Rottweiler, but I got her in college. I had all the time in the world to train her and socialize her. We were at the park every day. We went to training classes. That dog, I'll never have a dog that well trained again because I never have time for that. But if you're looking into a dog like Arati, they need to be trained. She was an 85-pound dog. The doorbell would ring. If she would run over a child to get to the door, we'd be in trouble. Like, you need to think about these kind of things. If you're going to get a big dog that is possibly dangerous, you need to train the hell out of them. Versus I have a medical release guiding eyes dog right now. I never really worry about her. She kind of came already knowing stuff. She's super sweet. She doesn't know how to bite. I mean, basically when she plays with me, she just flops on her back and kicks me a little bit. And that's about as aggressive as she gets.
Those are the best, those guiding eyes rejects, so to speak.
Yes.
Sophie and I can identify them from about 100 yards. We saw one yesterday at the lesson. Yep.
Yep. And we asked, and they were like, yep.
I was like, okay, that makes perfect sense.
Yep.
He's just like Babs, just sweet and loving and beautiful and just a good guy.
Yeah.
You can just tell.
Yeah, it was I got very lucky with her. She has an extremely sensitive stomach and some interesting eye condition that I haven't seen yet in the 10 weeks I've had her. But hopefully never turns into an issue.
That's why she was released.
Yeah. Plus she was a counter surfer.
Still?
And pulls on the leash. No, we were able to correct that pretty quickly. It did help that she broke her toe the day I signed the paperwork, so that helped with that part of the training, not so much the leaf pulling. So yeah, we've had her 10 weeks. 7 of those weeks she was in a splint.
Oh boy!
Like 2 hours after I adopted her, she broke her toe, and then 2 days after that, Lyme disease,
really?
Which I assume was kind of floating around, and then the stress of the toe kind of brought that to the forefront. But she's been good. Good little doggy.
So when you have these new puppies come in, like Sophie said, what is your recommendation as far as taking them out in public before they are fully vaccinated?
Yeah, that's rough because, it's not even the rabies that I worry about so much. It's parvovirus, and that can be deadly in 30, 40 plus %. I don't know. Someone will fact check me on that, but quite frequently. And even with care, and the care is extremely difficult and frustrating. It's tough for a general practitioner to treat parvo because you need to have them in an isolation area. They're having consistent diarrhea. You're trying to make up for their losses, electrolyte losses, fluid losses. Every time you go into that room, you have to gown up and put on booties so you're not spreading it around.
Sure.
So, the rule of thumb is really they're not socializing well until they get to like 14 weeks old or so when they've gotten their 3rd distemper parvo vaccine, at which point I'm like, go crazy, get them everywhere. But before that, I recommend they socialize on their property or the property of healthy vaccinated dogs in the area. You have friends with extra dogs, great, go there. People with no dogs, you want to go on their property, no problem. I don't want them going downtown. They don't necessarily have to eat the poop directly to get infected, but
really
dogs
just walk through it. No,
yeah, exactly. They step in the poop, they clean their feet with their mouths, and it's quite infectious and pretty darn dangerous.
So we're again talking about privilege in this area. It's not like it is in the South, where you have to be super vigilant with things like parvo and distemper and rabies and everything. But so. You get the people who are very much black and white about this, right? Like, I'm not going to let my dog leave the house. And then we see those puppies as 6-month-old dogs who are basically mental shut-ins, right? And we saw a lot of this with COVID for other reasons. Yeah. So staying away from places where there's high traffic of strange dogs, right? So if you're walking in a park where there's a lot of poop that hasn't been picked up, or you see a lot of dogs, that would be a place that you would recommend that they would keep an under-vaccinated dog away from until they were done. Yes. Yep. But still getting them out is super duper important. So we're always talking about balancing the two. That the chances of getting parvo, I don't know, what are they? The chances of completely screwing up your dog from not taking them out, there's a really high chance that that's going to happen. So that's always interesting. New York City, that's a whole other ball of wax.
Yeah, I don't know how city vets do it.
Yeah. I think they say no. And that's why every city dog we get is paper trained.
They're all paper training in the house. I don't want to paper train a lab.
Yeah. And let me tell you, they're labs, they're all kinds of dogs. Yeah. And then the first thing they say to us is, we want you to housebreak them now, which is fine. And
I do 50-50. I want half of them to time poop inside.
When I don't feel like taking them out, I want them to be able to figure out that I want them to use the paper. And when I do feel like taking them out, I don't want them to use the paper. So we try to explain that to them. But New York City, raising a dog in New York City, that's tough.
Yeah.
Because of these very reasons. They've got to go outside, but how do we do it in a safe manner? And New York City as a whole, as far as dog population, completely different than out here in the burbs. Yeah.
I haven't spoken with my colleagues in the city to see what they're recommending. I actually have no idea.
Yeah.
But it's easy for me. I mean, I have a lot of friends with dogs. And so, when I have the puppies, I just go to my sister-in-laws who've got dogs around the corner, friends everywhere.
So the last The last distemper parvo is at 14 weeks, but then there's usually one more. Rabies is done a little later, or no?
Generally, the rule of thumb is a lot of breeders will do a temporary vaccine at 6 weeks, but starting at 8 weeks, every 3 weeks for 3 doses. So 8 weeks, 11 weeks, 14 weeks, and you can give rabies after 12 weeks. I prefer to do it at 14 weeks. I don't need competing maternal antibodies screwing anything up. So usually I figure once you get past 14 weeks, if we start on time with the vaccines, we're good to go. And we still, around here, we need Lyme vaccine, definitely. I think Lyme vaccine is probably the vaccine I do that does the most good for these critters. And leptospirosis, I'm supposed to give to everyone. Lepto is a bacterial disease spread from the urine of wild animals.
That's changed, no? Because when you and I first met, you were like, I'm not doing that, because that has the most...
reactions, yeah.
Right, the highest percentage of reaction.
So, yeah, I've been practicing 17 years, something like that. And when I first came out, the lepto vaccine, I saw a lot of major reactions. I one time saw 2 dogs from the same family get that vaccine, unrelated dogs, middle of a tray. Both of them have severe reactions that required epinephrine injections, or at least steroid injections to pull them back. They both did fine. But what are the chances? And I wasn't seeing the disease.
Right.
So I really wasn't vaccinating much for it. I was vaccinating the hunting dogs. Like my dog who went mountain biking with me was through the trails all the time. But the house dogs, not so much. And then I went to a lecture, I want to say 10, 11 years ago, where one of the doctors who kind of sets the vaccine recommendations was lecturing. He was asking who was giving lepto, and me and another guy were like the only ones in the room who didn't raise our hands, during which point they revamped the vaccine. It's a whole lot safer now. I'm really not seeing much in the way of reactions. And before I started vaccinating more dogs for it, I did see 4 or 5 cases of it.
And what are the symptoms of leptospirosis infection?
It's not great. Liver and kidney failure. I mean, the biggest one was the first one was a probably 3-year-old dog who the owner said she's peeing and drinking a lot. I got him in, and he was in kidney failure, and so I added on a lepto test. He was positive. And he's okay. He's still alive.
So let's talk about how you get it, because I'm sure a lot of people don't know.
Sure. So lepto's a little spirochete, I believe, tiny little bacteria, and it is from the urine of these animals, foxes, skunks, rats, raccoons. In the city, it's rats. That's why in the city, everyone's vaccinated for lepto. It's pretty common there from the rats. Around here, I think skunks and raccoons are the biggest reservoir for it. And, you walk them through the woods, there's a puddle of pee on a leaf. They have to smell and lick everything, because you find some pee, of course, you have to taste it. And
that's my motto.
They're not wrong. And so, they come back. It's not super common, but they either come back in kidney failure. I saw a golden retriever who was just yellow, like the eyes were yellow. Unfortunately, that one didn't make it.
And is that transmissible to people?
It is a zoonotic disease. It can spread to people, which also puts me in a weird condition.
Again, you would have to be exposed to that infected dog's urine.
Correct.
Okay.
So when we have a lepto suspect, everyone knows, and we probably should wear gloves more than we do anyway, but we're cleaning up the urine with gloves and just being more careful.
Right, and so you would imagine a dog that's ill with lepto might be peeing in the house because they're drinking a lot, right? And so you're cleaning up the pee, and then you're being exposed.
Exactly. Yeah, you're seeing a large increase in peeing and drinking, that's anytime you see a large increase in peeing and drinking, you should go to the vet. That's one of those, yes, get in, because are we talking about an infection up in the kidneys? Are we talking about diabetes? Are we talking about Cushing's disease? Are we talking about kidney disease? There are a lot of differentials, and we need urine, we need blood to figure out what's going on. And sometimes it's just they're crazy and they enjoy drinking. A condition called... Or they're old.
Like Ruby, old.
That's the thing. I mean, there's a condition called psychogenic polydipsia where they just drink a lot, and it's, all in their head. They got a drinking problem. But that's a diagnosis of exclusion. You can't, prove it. You have to prove it's not the other things, which takes a little while.
Yeah. So the lepto vaccine lasts 1 year? 1 year. Okay. So
first time you have to booster it 3 weeks later.
Yeah. We really should get on that, because I'm pretty sure that most of our dogs do not have leptospirosis.
And I run my dog in the woods.
I know. Yeah, Twiggy definitely. Yeah. Ruby, so that's a good question. We're talking, Twiggy is one of our youngest dogs. Ruby is 13 and a half. So at what point do we stop giving vaccines? I mean, in New York State, you have to be vaccinated for rabies, so that I understand. But like Ruby's 13 and a half. My mindset is, at this point, does she need to have any more boosters for distemper and parvo?
Well, in a perfect world, I would like to do yearly titers to see if we have protective antibodies going around. Probably distemper, I don't know, 10 plus years ago turned into an every 3-year, distemper parvo turned into an every 3-year vaccine. And generally I'll see positive antibody tests 5, 6, 7 years afterwards. So you're probably good. She's been getting it every 3 years. Can I promise you? No.
But we could always titer test her.
Yep, you can always do the titer. It's not a big deal. Usually 2-3 days we get the results. You can do one that gives you like an actual level or just like a pass-fail, like yes, we're at the protective level or no, we're not. And then we kind of pray that it lasts until the next year when we test it again. Right. And there's no true way of knowing exactly when it'll fade.
Is there any reason not to give a 13-year-old dog vaccines?
Probably. I mean, if they're otherwise healthy, it's not like all of a sudden their immune system's going to go haywire from the vaccine. I'm never one to... It's easy for me. I tell people, look, if you want to separate the vaccines, I don't care. I'm happy to do so. They're generally fine to give as a bunch, but do I want to give your Yorkie 5 vaccines at one time? No.
Right.
But if you want to get it to the the boarding facility and you need flu and kennel cough, rabies and distemper, they'll probably be fine. Or we always separate them by 2 weeks. More than happy to have you come back in 2 weeks and split them into 2. There's probably no reason in an otherwise healthy 13-year-old that I couldn't booster vaccines and give it to him. Okay. That would be fine, objectively, but like emotionally, I'm like, you're old, I'd like to stop. Right. I do understand.
And she doesn't even leave the house.
Oh, there's that too. Their lifestyle changes. So what are the risk factors?
Right. I mean, she doesn't we rarely even take her anywhere at this point. Although she's a very active 13 and a half year old dog. I don't see her going anywhere for quite some time.
No, it's like a 10-minute walk. It's like 5 minutes out, 5 minutes back, and she's done. And it's just like, what kind of walk is this? So
she seems very happy in the limited life she has right now.
I'm sure she would let you know if she wanted to do more.
Yeah. Sometimes her brain wants to do more and her body does not cooperate. Yeah. Like my brain says I can jump down 4 slate steps.
And chase after a rabbit.
And land perfectly fine on the slate bottom. And then my body says, no, we're going to smash your face onto the slate.
Yeah, I feel that. I absolutely understand that one.
Like a dummy. Of course, Tula does the same thing, and she's the exact opposite. She leaps now off the top of the front steps. Did you know that?
No, I did not.
Yeah. So, I'm then thinking about her front legs and joints and all this stuff, and I'm like, whatever.
Whatever.
She'll be fine.
Hopefully.
If not, we'll just hop down to the animal hospital.
So let's talk about your other opinions on typical stuff. What are your opinions on spaying and neutering ages? Has that changed over time?
Yeah, that's a rough one. I don't think anyone knows for sure. It's interesting because for the last couple of years, we've been trying, especially the large breed dogs, to push it off until 14 or so months. Let them, let their long bones close. There's some data to suggest that if you neuter or spay earlier, they actually grow a little taller than they naturally would, change the geometry in their joints a bit, and have like a greater likelihood of ACL tears or hip issues.
Okay, wait. Say that again. If you spay and neuter both, or just neuter?
I think it's both.
Okay.
And you do it earlier. There's a delay in closure of the growth plates, so they actually grow taller. Yeah.
So kind of like isn't that true for oxen? Like, isn't it?
I know they exist.
Isn't it a gelding thing? Like if you geld a horse, they grow bigger. If you geld a bull, they grow bigger.
That's it. I don't know.
I've never heard of that.
All right, sorry. I don't mean to interrupt you, but go ahead.
I don't know. But
so we feel like if they're not neutered, they grow bigger. But you're telling us, no, if they're neutered young, they might be taller.
Well, they get, for, let's say, a male pitty, for example, you leave them intact, they're going to get the big head, they're going to be more heavily muscled. If you neuter them earlier, they might be slimmer, but taller.
Okay, all right.
And then there's some thoughts on Rottweilers, neutering them and spaying them increases the risk at some cancer. And I think in labs they found that too. The problem is leaving them intact causes a whole slew of other issues. And that's what we're seeing right now, because we've been
Intact for life.
Intact for life, or even intact to go through 2 heats. Because we're seeing an increase in mammary tumors that we don't see if we spay and neuter at 6 months. Something that I don't know if the
Increased chance for pyometra for sure.
We're seeing more pyometras. Yeah, we've
people
done
don't even. The thing about pyometra is people don't even know the symptoms.
Oh, it's
and
rough.
it can happen so quick. And if you're not paying attention, which most people wouldn't, suddenly your dog's critical.
Well, and it's rough too, because you've got this dog you didn't spay. They're 8 years old. They were in a heat 2 weeks ago. And all of a sudden they feel like crap. It's a closed pyometra, so the cervix is closed, which means the pus in the uterus, for anyone who doesn't know what a pyometra is, it's a uterine infection. And it's progesterone kind of pushes it. So interesting enough, you can keep the uterus, you remove the ovaries, you never have that issue too.
Say that again.
So
you can keep the uterus, but because it's
progesterone causes from the ovaries causes the pyometra. So if you do an ovariectomy, a spay in America is an ovariohysterectomy, uterus and ovaries. But in Europe, they generally just do ovariectomies, which I've done a couple times. It's a little annoying just because you have to go find both ovaries instead of tracing it around the uterus. But basically, what I see, if it's an open pyometra where the cervix is open, it's pretty obvious because there's pus leaking out and it's disgusting.
You would think it'd be obvious to people.
So?
Come on now, Paul. You know, somebody who hasn't spayed their dog and they're 8 years old now.
They might not be paying attention.
Yeah, it's generally not the kind of dog owner who is paying close attention because they're not even reading the most basic stuff on what is healthiest for a female dog. And we don't encourage people to spay super early either. We don't believe in that either. But they're not it correlates with the client, right? So they're not paying attention, and now the dog is critical, and it's a horrible way to die. It's a terrible death for that dog.
It's not good. I've seen ruptured uteri. Whatever.
Right. So then when it's a closed pyo, and then you have a chance of that rupturing when you're going for surgery. Yes.
Oh yeah, I think I might be a little off, but one time I removed a 13-pound uterus from my 20-something pound dog. It was insane. The dog was like half uterus. I had to have an assistant in there holding it with 2 hands because I was afraid it was just going to crack. And I don't know how much flushing you can do to clean up that abdomen once it's a septic abdomen like that.
So if you just remove the ovaries, the dog's no longer going to go into heat.
Correct.
So it's basically, for the layperson, is the exact same thing as a complete spay.
It is legit to do ovariectomy.
So why is it different in Europe? Why do they only do that, or more commonly do that in Europe?
I don't know. I think it's just what they do.
Just because they're annoying Europeans?
It's,
because they got to do things different than us?
I guess you can do it maybe with a slightly smaller incision, although you see some of the spay-neuter clinics where these vets do spays and neuters all day, and they're doing a spay through a 2-centimeter incision, but it's easier to do.
Is that big or small?
Well, it's tiny.
Okay, that's small.
Yeah,
all right, well, I don't know.
Versus, you see a new vet and it's like 8 inches long. They're just trying to get exposure so they can see. Right. Because a spay is not actually an easy procedure. I mean,
So what would be the benefit of leaving the uterus? Is there any benefit?
Well, there may be some cancer suppressive... leaving the uterus and removing the ovaries.
Right.
I don't think there's a benefit. It's maybe a quicker surgery for these people.
Maybe more of just the custom in a country.
Mm-hmm. Yeah, I mean, basically you're either tying off the pedicle, the blood vessels under the under the ovaries, and then, the way I would do it is also around right in front of the cervix and then in front of the other ovary. Or they're just cutting and tying below the ovary and then right in front of the ovary and then just taking out just like a little swath of tissue containing the ovary.
Interesting. I did not know there was a difference in that between us and those snobby Europeans. Sorry to our European listeners.
Our European listener.
So, all right. So, for spaying, what do you recommend for age?
Well, that's tough. I feel like we are leaving them longer, and now for me, it makes it into a much more difficult surgery. Now we have a whole lot of fat around the pedicles. We have fat between the skin and the muscle layer. It's slippery. It's a more difficult, more risky surgery more likely to have a suture slip. So that's something that's happened while we're pushing it later on in life. It turns the surgery into something more.
Is that
more
true
difficult.
if the dogs had puppies?
Yes, but things are a little bit stretched out, so they're also a little easier to work with at that point. When you like the worst part of the spay is when you grab that ovary and you have to break down the ligament that kind of holds it deep in the abdomen. You kind of strum it with your finger until it breaks down, and then you have some room to work. But when that tears, my heart drops every time. It's been like 17 years because you don't know if the pedicle containing the blood vessels is also torn. So you kind of just stretch it and strum it until it breaks. I mean, it's not something that happens frequently, but then you have these bigger dogs. Everything's big. There are more blood vessels. They've been through a bunch of heats. They've had a bunch of puppies, and it's just a bloody, fatty, slippery surgery. So for the surgeon, I would much prefer to do it at 6 months old. They're quicker.
It's basically an inactive organ, basically, at that point.
Their uterus is like the size of like a less than a big pen. It's like it's nice to work with rather than
Interesting.
Significantly thicker than my thumb.
Did you know that when we spayed Meadow, that I asked Ryan, Dr. Arucci, to open up her uterus and take a picture of it for me?
I did not.
Did you not know that? Yeah. So all right. So just a little backstory on Meadow. She had a couple. I think we had 2 litters with her.
2.
And then we had some issues with Vivi coming in the house, and they started to cycle a lot. Remember, like in very quick succession, like every 2 months, which is really bad for their uterus. And it was the 2 females, sort of hormones, sort of competing in the house. Anyway, so we went to breed Meadow, and she didn't take, so we ended up spaying her. But I suspected that her uterus was quite scarred at that point because she'd been through so many heats after we spayed her, after we bred her. So Jacob actually assisted on the surgery. And I said, can you ask him to open up the uterus so we can take a look? And he did. He opened it up, and they took a picture and they sent it to me. And it was, of course, all scarred up from the cysts and stuff. And it was clear that we made the right decision, that she was actually never going to get pregnant again. I'm correct about all of this information, right? Jacob says, yes, I am. And so I had that picture, which I found fascinating because I'm a geek that way. And I shared it on my Facebook group, my whelping group, and it has like 50,000 members. And they went bananas for it. They were like, this is so great. Thank you so much for sharing this picture. So anyway, these are the benefits of having a good relationship with your vet. Can you open up my dog's uterus? It really is. It got something like 5,000 comments. It was crazy because that group is just like me. They're like, they love that kind of stuff. Anyway, sorry, off topic. So benefits and disadvantages to spaying early as opposed to late. What do you recommend for boys?
That's another tough one. They sure get annoying once they reach adulthood with their testicles and start peeing on things and going to chase the ladies. It once again also depends on the size of the breed. The bigger dogs, I think it's nice to make it till their growth plates are closed. But sometimes their behavior just makes it impossible and you have to do it sooner. And once again, it's also much easier to do when they're little. But with the boys, it doesn't matter as much.
If you were to guess, what percentage of your male dogs are intact, like for life? Like
around here?
Yeah.
Well, less than 5%. Almost everyone spays and neuters around here.
Again, that's a really regional thing. Regional state, regional country, regional world. Yep. In Europe, it's like, I would imagine, completely flip-flopped. Like, they don't neuter over there.
Yeah, I'd say, like, funny enough, it's pitties. That'll be intact the longest, and Yorkies. I have a bunch of Yorkies that are intact. Yeah, it's a funny coincidence. I don't know why, but that's how it is.
I mean, as you know, we neutered our boys when they started to fight. So it's been a bit over a year, and it was a hard decision for me because I love an intact boy. I just do. As a breeder, you fall in love with the structure of an intact male as opposed to one that's been neutered, especially neutered young. Because they really look
completely
different.
Yep. Even like coats for like females too. The coat's different. The skin's different. Like if you touch our males' necks, it's so thick.
Yeah, absolutely.
And then you touch the females' necks, and you're like, this is like nothing.
Right, and of course we've discovered why the males' necks are so fucking thick.
Yeah, and that's okay.
Because when they fight, then they don't rip each other to shreds.
Yeah.
So, and we found that through experience.
It doesn't work in our little micro society here. We can't have this. Now, my old dog, Mason, he was neutered. I got him at 9-10 weeks, and he was neutered and healed at that point. And,
that hurts my heart.
Yeah, that was too much. He came from the shelter that way.
Yeah, so neutering is basically what we recommend as breeders to our clients vis-a-vis spaying and neutering is we've of course evolved over time with a better understanding with the science and understanding dog breeding and our particular breed, Australian Shepherd. So what we encourage for our female puppies is we encourage one heat, but only one heat. Most of them don't make it. Most of them decide they choose to spay sometime between 6 and 12 months, which is their right. We're very much like, it's your dog.
Exactly. Yeah.
Like you sign the pay, it's your dog. So we understand that people make those decisions. We sort of put it in the contract, like this is what we recommend. This is what can happen if you don't follow our recommendations. So don't come back to me with those problems, right? And males, we really encourage them to wait, between a year and 2 years of age. And again, most of them can't seem to wait. And I understand that. And we say this to our clients as well, our training clients, that you really have to balance reality, behavior, and what's best for the dog. And you're talking about very large numbers, of course. These studies are based on huge numbers. And you're talking about one dog.
Yeah.
So, yeah, we've become a little creepy about identifying males who've been neutered too young. We've become a little bit creepy.
What do you point at them?
in the way we look at them and go, this one was neutered super young. I can just tell.
Yep.
Yeah, I don't have any problem with your recommendations. I think we probably discussed it as well. And yeah, it's tough. If I say wait 18 months to neuter your male, but then you want to take them to doggy daycare, and they're like, we won't take an intact male.
Exactly.
Like, well, you're not wrong. For 50, 70, 100 years, I don't know how long we've been neutering them at 6 months.
Right.
And
right.
Our dogs are generally fine.
Right.
But in a perfect world, do you guys take boarding intact males?
We do. Mm-hmm. We do. But we don't board to the general public.
Oh, okay.
So we only take back boarding dogs we've trained. Mm-hmm. And we do take our puppy clients back. So we actually have Cyrus coming.
Yep.
This week, who's a dog that we bred here,
mm-hmm.
Twiggy's son, yep. And they did not neuter him, and I'm sort of fine with that. Our clients are super responsible too. There's also a responsibility in not letting them run free and impregnate dogs and all that kind of stuff. Mm-hmm. Our clients are paying a lot of money for a puppy, so they're generally very insistent on taking very good care of them. And when we saw him, I guess at about a year, he came back for training.
He came back for training
about
and he
a
looked
year.
like a dorky teenager.
But absolutely freaking gorgeous.
And then we were like, are you going to keep him intact?
Because we're fine if you want to keep him intact.
We might use him in the future. And they were like, oh, well, that would be great. Like, what's the benefit? Like, if we do keep him intact, we're like, well, you get a payday if he successfully impregnates a female. And they were like, absolutely. So, we're like, as long as you can keep him intact. But as soon as you can't, neuter him. Because they have kids and stuff. And
Right. So they're really under no obligation to keep him intact, but they're into it. They only have one dog. Mm-hmm. They're in a neighborhood where everybody's leashed. Yep. They would never let him run at large. And he passed all his genetics. He has a beautifully clean panel, which I am so excited about.
He's gorgeous.
And he's a black tri with these piercing blue eyes and just a personality to die for.
Yeah.
So I don't know how we got on this subject, but
neutering. But he's going to keep his boys.
He's going to keep his boys. And Ty got neutered. He was, I guess, if it was a year ago, he got neutered at 9. Mm-hmm. I like to think that probably would be healthier for him, because I think when you get to later in life, right, for an intact male, then chances of cancers go up, no?
Well, we see a lot of prostatic enlargement where they do have trouble peeing. I've had a couple dogs where I had to neuter them because they just couldn't pee. We also see, it's kind of gross, these perianal adenomas, which are little butt tumors. They're benign, but they bleed and they get inflamed and infected. Mm-hmm. And it's not real fun doing surgery over there. We can remove them.
He actually had a tumor, a rectal tumor, that he had surgery for successfully. I wonder.
They thought it was cancerous too, and
And 3 years later, he's still alive. So clearly it wasn't cancer.
Probably
But
not.
I wonder if that was testosterone.
It was like
fueled.
literally on his anus. Did I do it?
No, you didn't do it because we went to a specialist, but it was within a finger's reach. So not
Yeah.
far
Oh,
in.
inside.
Mm-hmm.
Yeah, inside.
Maybe. Yeah. Maybe. I'm glad you did. Those are no fun to do. You can go bother those specialists with those. I like to sleep at night.
And that's part of what she said. She said, it was tested cancerous. It's, I guess, considered a polyp.
Oh, I do remember this.
Mm-hmm.
Yeah.
So it came up cancerous, but she said, they think they got it all, but because the wall of the intestine or the rectum in there is so thin, it's very hard to get clean margins, I think is what she said.
It is. I mean, yeah, you want to try and get a good section of clean tissue around. This one was on a stalk, I think. So you got the like bulbous mass and then like on a stalk and then it goes into the wall. But in a perfect world, you get 1 centimeter or 2 centimeters of normal tissue around it.
Right.
You're not doing that, or you're going to create a stricture in the rectum. It's going to be narrower than you want it to be. So sometimes it's tough. That's when we say getting margins
Right.
is sometimes impossible. Like you get a lot of these dogs will get tumors down on their ankle area, and like, yeah, I can take it off, but if you want me to close the skin, I can't get
Right.
2 centimeters on either around it. It's just not going to happen. And then you start talking about radiation or chemotherapy, which a lot of people are like, well, I'll absolutely do surgery and take a tumor off my dog, but I'm not willing to take that next step, financially or just time or ethically. Now with chemo, I'm not telling people they ever have to do chemo, but our goals in chemotherapy in dogs is to keep their quality of life decent. Keep them happy versus people, we'll take you to the edge of death to cure your cancer. That's not the goal with chemotherapy in dogs. That being said, plenty of people are against it.
Right. So that's not your goal, but does that necessarily mean that's what happens?
Oh, they certainly can get upset stomachs. They don't tend to lose their fur. Usually the biggest side effect we see with chemotherapy is vomiting, diarrhea, more so diarrhea.
It goes back to them not being able to tell you how they feel, which makes me
They cannot
anxious.
consent on it.
Right.
Yeah. I mean, for example, my mom's cat has lymphoma. He gets a chemo drug, an oral one, every other day for the last 18 months, and he's been perfect. He gained his weight
And
back.
that's
He's
just
doing
a
great.
Pill.
Yeah. Chlorambucil. It's not a
So
big
you're
deal.
not hooking them up to machinery and IVs and doing a drip and all that.
I'm perfectly happy with doing that.
Gotcha. Yeah.
My Roddy had a tumor. She needed radiation. And, I removed it, but it was coming from the optic nerve. There was no way I could remove that. And so we discussed radiation. I was like, that's not something I'm gonna do. I can't afford it, and
Plus the
I don't have the time.
stuff around the eyes. I imagine
Anesthesia.
that's
I'm just not doing it.
painful.
So yeah, you have to decide what's ethically right. What
Right.
what kind of dog you have. I mean,
Right.
like some dogs are. You got a lab who likes everyone, and you want to try and treat the lymphoma, but they're happy to go to the hospital and get an IV placed every 2-3 weeks, and hang out for a couple hours, and it doesn't affect them. Sure, you can consider it. But if you have, let's say, a stressy German Shepherd,
Right.
Who
can't
hates
even
it,
come in for vaccines without losing it.
you're
right?
not even going to consider that. Like it's just not okay.
I mean, you shouldn't consider.
You shouldn't
that.
consider it. It wouldn't be right. You got to know your dog.
Doesn't mean you won't consider it.
And then it also goes into our diagnostics, which is, well, why are you doing this ultrasound? Because I'm looking to see if there's cancer. What are you going to do if there's cancer there?
Are you going to treat it right? Right.
And then that's when, okay, you want to try some steroids. What else are we going to do? We can try palliative care, keep them comfortable as long as we can, as long as they're social, as long as they're eating, drinking, hanging out with the family, able to make it outside and pee and poop, and not in significant pain. We can keep them going. As soon as their quality of life decreases, that's when we have to let our pets go, which it's a totally different subject that we jumped in. But.
And I think that when people talk to me, family and friends talk to me about euthanizing their beloved pet, and a lot of people will talk to me about it because they've known I have had 20 dogs or something like that, and so I've been through this a lot, and they'll ask me my opinion because they also know I am emotionally pragmatic, and will probably tell them what they're feeling and can't admit to themselves. It's such a tricky subject, and you try to tell people, you try to balance the pluses and the positives and negatives. But when you're talking about, I had a friend who was going on vacation, and her dog was clearly, the kidney numbers were terrible. So she's old, she's 14. And they were going to go on a 2-week vacation. And she was like, I don't know what to do, because what if she becomes critical when I'm gone? You know, and my suggestion or my recommendation was better a little too early than a little too late, because it will be awful for her to die on the dog sitter, first of all. It's a terrible thing to do to your dog sitter, but also not, you know, without you there.
Yeah.
And she was really, I give her a lot of respect, because she did end up putting her down before she went on vacation, which sounds, you know, some people hear that and they're like, oh, you just wanted to go on vacation and have a good time. No, that's not what it's about. It's about prioritizing my dog's comfort over maybe what makes me feel sad. And, you know, we've certainly been in those circumstances.
And you never feel good about it.
You never feel good about it. You always feel like you did it wrong.
It's too soon, or it's too late, or that, you know, you never feel good about it.
Nope. And I think you gotta sort of
be okay with it.
Yeah, going into it, you gotta know that you're never gonna feel good about it.
Yeah.
You're gonna feel like shit and you did it wrong.
Yeah.
No matter what decision you make.
And you always have that thought of just like, what, like, who am I to take this?
Right. Who am I to decide
life?
whether this dog lives or dies?
Yeah.
And, you know, ultimately that's what you sign up for when you get a dog. You sign up for that. And if you can't handle it, don't get a live animal that depends on you, because it's your ultimate responsibility and act of compassion for this dog that you love so much, or cat.
Okay.
It's a medical procedure that you have to decide, just like any other one. Unfortunately, it's the big one, but.
And then, you know, you're like an ambulance, like a paramedic, in that you unfortunately have to be there for those really sad moments, which, you know, I'm sure takes a toll on your mental health as well.
It is definitely not fun, especially, you know, people I've known for 20 years, dogs I've known for 14 years from like a puppy. It's not good. And I can't dwell on it because I have a half hour to do my euthanasia, and then I have my next appointment.
Well, and you shouldn't dwell on it, because
you can.
I mean, you couldn't function if you got emotionally involved, just like any other doctor, right?
There are days, where I have 2 or 3 in a day, and it's terrible. But it has to be done, especially right around Christmas for some reason. That's when it always is. Always kicks up. I think it's because the kids come home from college, see the dog, and they're like, whoa, this is bad. What are you guys doing?
Right.
And then they come in.
Yeah, my dad had to put his bug to sleep last 2 years ago, I guess. And, you know, she was pretty sick, but they decided to do some steroids. And she bounced. You might get a couple of months out of her. And he got 48 hours out of her. And then she just crashed overnight. Of course, it's overnight.
Of course.
And it was absolutely devastating. So again, you feel like shit, but I'm like, listen, we made the best decision we could based on the information we had in front of us. And
her behavior.
And
her behavior for the most part was fine.
Once she came out loaded up with steroids, and they can extend life for many months, and you're like, wow, it's a freaking miracle.
Yeah, but I think with her particular, she had a burst, and then it was just like...
Yeah. No, that was awful.
Yeah.
And, you know, obviously if we could do it again with a crystal ball, we would have done it differently.
Yeah. But you never feel
good about it.
I never felt good about it once.
Well, before you tried to do anything, like if you just euthanized without trying.
Right. Then you sit there and go, well, maybe we were too quick, you know, to pull the trigger, so to speak, and blah, blah, blah. So, yeah, it's a sucky. It's the worst part about being a dog owner, or a pet owner of any pet, really. A horse, dog, a sheep.
But in my opinion,
a donkey.
It's so minuscule to like owning an animal. It's just like it's not. To me, it's not even on the table of a reason like why I wouldn't own an animal.
People are like, I can't do this again. I'm like, I'm not going to tell you to do this. Get another dog right now. But you're a dog person. Give it a little time. You'll get over this.
I'm the opposite. I say go home and get a new dog, because nothing heals your heart like a new dog. And they all say to me, never again.
He was once in a lifetime.
Again. And then
I'm just like, he is once
2
in a
weeks
lifetime.
later they have a new dog and they say, oh my God, you were so right.
Exactly. And then you also forget how much fun it is having a puppy around after you had this like 13-year-old dog that you had to like
that
carry
you were wringing your hands over for 3 years, you know.
Carry off the couch and stare at all the time.
Yep.
It's like a different... I right now I have 2 dogs who are barely over a year old, and then my setter is 11-ish. So she's happy because the 2 play with each other and leave her alone. And she just gets pet. That's basically all this dog's ever wanted.
She's a sweet girl.
She is. She's.
All right. So where are we at, Jacob? 70 minutes?
Yeah, 70 minutes.
We maybe should wind it up.
Yeah, we're doing
Oh, gosh.
Yeah, I was gonna say.
We should.
Oh, man.
Is it a quick story or is it a long story?
All right, so I don't know if you know this, Dr. K, but we do this segment called I Bet I Can Make You Cry.
Oh, that sounds awesome.
This one isn't really sad, but it's a cute
we
story.
just talked about euthanasia, so I feel like if we would have
last week, Sophie and I were both bawling through the whole thing. But this one is not so bad. Hey, Soph.
Hey.
I bet I can make you cry.
Bet.
All right, so you guys have probably heard this story. This is about a little dog, a stray dog in the Gobi Desert with a guy who was at a, what do you call it, an endurance runner, those huge 150-mile races. Mm-hmm. This is written by T.C. Newman. All right, so it was in the middle of the Gobi Desert where an unexpected friend entered the ultramarathon runner Dion Leonard's life. So it's an ultramarathon runner. It was the second day of a 155-mile race through China. That exactly. Look at Sophie's face. That makes me cry.
I can't do like 100 on a bicycle.
I know, that's what I'm thinking.
I can't even imagine that.
And through a desert? No, thank you. When a small dog decided to befriend him, a little dog comes out of nowhere and starts running the race, and then decides to join me in the week-long race as well.
I think I know the story.
You do? Yeah. It's a cool story. Over the course of this grueling 7-day race, runners carry all their food and gear on their backs. Okay, I didn't think they could make it worse. They just made it worse. On the second day of the race, Leonard said he saw a little dog with sharp teeth chewing on the covers. Now I'm calling out to everyone, okay, whose dog is this? Someone come get this dog away from me because the race is about to start. But as I call, the gun goes off and starts the race, and all the runners go running down the trail ahead of me. So I'm stuck there with this pesky dog attached to my legs. Out of 101 people that start the race, all of the other volunteer people around the race, she decides that I'm the one for her, Leonard says. With the determination to win the race, the little dog's presence was something of a hindrance. At one point, I can take the lead of the race, or I can go back and help her across the water crossing, Leonard remembers. I'm about to take the lead when I hear barking and yelping and whining behind me. She knows if she goes into the water, it's rushing so fast that she's going to get swept away. Then she's going to drown. She's going to die. He calls that split-second decision to go back for the dog life-changing. When I pick her up and have her in my arms and carry her across the water, I look at her and realize this is pretty incredible, he says. Maybe we are meant to be friends a little bit longer. By the time the race was over, Leonard and the dog named Gobi, after the desert where she found him, were in love. Where he found her. Leonard said he saw a bit of himself in the dog. I had really a difficult, depressive, and abusive childhood, he said. I see this dog that no one cares about, and we don't know where she's come from and what she's doing, but she certainly had a pretty tough life herself. It seemed like fate. I was here meeting her out in the desert. These two lost souls perhaps meant to meet. But bringing Gobi back to Leonard's then home in Scotland proved to be difficult. She needed medical tests and clearances in order to leave China for her new home in the UK. Gobi was left behind with a friend who promised to care for her during that process. But after Leonard returned home, he received a call that Gobi had gotten lost. I think that's sugarcoating it. It sounds like they didn't take care of Gobi and she took off. But whatever. I'm devastated and heartbroken. I think to myself, I'm never going to see her again unless I do something about it. So he got on a plane and went back to China to start looking for the dog, which is pretty cool. Without speaking the language, Leonard organized a team of volunteers who printed flyers and canvassed the local area. The reward for Gobi's return caught the attention of potential scammers. People then started to ring up and say, we know that you have more money to offer. They were threatening to kidnap me if I didn't pay them some money, the money that we had. Despite the setbacks, Leonard was determined to find Gobi. I think a lot of it comes back to me thinking that I saw something in myself in the dog. And I wanted somebody to be there for me when I was growing up and offer support and kindness, something I wanted to offer to this dog. After 10 days in China and the weeks after Gobi had gone missing, Leonard was reunited with his little puppy. Leonard recalls the moment they saw each other. She came running up and jumped in my arms. Yeah, I knew straight away that it was her. So it was such an incredible moment. I'm in tears, and the search and volunteer team were in tears as well. During the time she had gone missing, Gobi was hit by a car. This is why
Terrible friend.
I don't
Terrible
like that friend. Jeez. Needed surgery, so the vet said she risked losing her leg. For over 4 months, Leonard stayed in China while she recovered. That's dedication.
I'm impressed that the dog could jump into his arms with a broken leg.
I know.
Right?
I was like, maybe it was
It was
the
just
back
a little
leg.
broken.
Leonard and Gobi spent the time getting to know each other and falling in love all over again. Once she was well, she moved to Scotland. She adjusted to her life with Leonard, his wife, and his cat. I really do think she's an angel because she's brought so much joy and light into people's lives, not just ours, but all around the world. Leonard is still racing, because he's a glutton for punishment apparently, and plans to go back to China, the same place he found his beloved dog, for a 250-mile ultra marathon.
Ooh, I'm gonna do that next time.
As for Gobi, she's become a sideline cheerleader because she's like, yeah, I'm not running 250 miles, and I am hell not
Exactly.
going back to China. No, thank you.
She's now a spoiled Western doggy.
That's right. She retired from long distance running after the race in the desert, but she still loves to go on adventures. Adopting Gobi has made Leonard a much kinder, softer, and better person, he said. It's cute. It's a cute story.
Yeah.
It's
We
a
need to
quickie.
flash some pictures of Gobi. I'm curious what this dog looks like.
I'll give them to
Do
Jacob.
that in the post edit here.
She's small, and she's like almost like a little Benji. Almost, I mean, I'm
little,
sure
like,
she has
terrier
no
mix thing.
Russell's Griffon in her, but like this little sort of brown, shaggy thing. She's super
Yeah.
cute.
Yeah, I've seen the videos on Instagram.
Yeah, so she ran most of that race,
Yeah,
which
which
is
is
really pretty incredible.
incredible.
Apparently, 2 days of the race,
Yeah.
they pulled her and held on to her because it was too hot for her to run, and then drove her to the next destination, and then dropped her off with him, and she finished the race with him. So,
Yeah.
I mean, I think it's a sweet story and stuff, but I just look at the dog and I'm like, oh no, she knew exactly what the score was.
Yeah, she found her sucker.
That's right. She was like, oh, this
Oh,
guy
look at
from the
this guy.
UK?
He smells like you.
He'll feed me.
I'll help you with your childhood.
Oh my god, it's too funny. Anyway, that
Smart
wasn't
doggy.
much of a tearjerker. So
Nope, we made it.
Yeah.
High five.
I decided to give you a break this week after our cry fest last week.
Well, I did choose the story.
Yeah, we couldn't find a good story last week, so Sophie just told me to tell her about my stray dog and how I actually rescued her and when I had to put her down. So that was a tearjerker for sure. And I'm sorry for people who wanted to see pictures of Dibby, but they're actually at the storage unit.
Yeah.
So when we move and we empty the storage unit, maybe I'll pull those pictures out. And
Because she had mange.
she had demodectic mange.
So mom has like photo Polaroids of each day. And
Oh,
how
with the
she
no
got better.
fur.
Yeah, which is pretty cool. Yeah.
The crazy thing about Demodex now is you can just give them the oral flea and tick preventatives to treat it, like once a month instead of
Really?
ivermectin every day.
Wow.
I assume that's what you did, right?
Yeah, like the baths.
Oh, and you were doing what was lime sulfur? I don't even remember what you used.
I mean, this
Never
was
even
20.
bothered.
This is almost 30 years ago.
Yeah, it was when I first started. It was ivermectin liquid. Tastes terrible every day.
And you know how I feel about ivermectin. We don't like it because we own Aussies, so we
Yeah.
hate ivermectin.
White feet don't treat.
There you go. All right, so this has been a nice chat fest. 78 minutes. I got my own timer, so I don't have to keep asking Jacob.
He likes to be included, though.
We didn't ask you too many questions this week. All right, so we should wind it up. All right. Well, thank you so much for joining us,
You're very
Dr.
welcome.
K.
Thank you for
We
having me.
Appreciate your time
No problem.
and listening to us geek out about vet questions. I hope some people found that interesting, other than the geeks like ourselves. All right, guys. We'll see you next time on Dog for Thought. Bye. Dog for Thought is written and hosted by me, Sarah Brown, co-hosted by Sophie Brown, produced, edited, and original music by Jacob Brown. Don't forget to like and subscribe.